Centres around New Zealand have been told to reduce their number of in-person consultations by 70%. But as our healthcare system becomes contactless, it doesn't mean you should avoid your own health issues. We're here to provide some guidance is TEND Director of Medical and Health Services, Dr. Mataroria Linden. Good to have you with us. This idea of contactless visits with our GP, it's new for a lot of us, but not for you. You've been working on this sort of thing for a long time.
Yes, TEND is a digital healthcare service where patients will be able to have an online consultation with their doctor or nurse, and that's where the health system's heading here in New Zealand in response to COVID-19 as well. As you say, the vast majority of general practice consultations need to be done over the phone or through virtual consultations, but that still doesn't mean that people don't have other health problems that they still need to see a doctor about. And so I definitely encourage, whether or not whether it's COVID symptoms or whether it's trying to manage your diabetes, to still make sure that you're looking after your health and still contacting health services when you need to.
Absolutely. I mean, people are a little bit nervous in some situations to leave the house. I mean, I said to my son the other day when he was halfway up a tree, don't you break anything because I don't know if I'll take you to the doctor, which I clearly would have if he'd broken something. But at what point do you make the decision that you actually need to go and see someone face to face?
Well, definitely if it's an emergency, you still need to dial 111. People are still going to have injuries and they still need to get seen. People still need surgery for an appendicitis. So definitely it shouldn't necessarily be a thought about when you need to call a doctor. If you feel that you need medical attention, you should definitely call either 111 if it's an emergency or your local GP clinic as well, and they can help provide that advice. Of course, there's also a helpline as another source of information too.
As we move through this COVID era and hopefully see the end of the COVID era, do you think we'll see more digital consultations, that's the way we'll end up moving?
I think COVID-19 has caused a massive shift in the way healthcare services are provided, including the move towards virtual consultations. And that's what TEND is going to be providing too, and that's why we're launching. I think after the response to COVID-19, there'll be more and more people who are more familiar with having virtual consultations. So I think things will change after COVID-19.
I suspect it puts a different sort of pressure on both patients and doctors. What are the benefits, but also what are the cons of going to this form of consultation?
Well, a service like TEND is all about trying to provide convenience and access to care through technology. We're used to accessing a whole host of different services through our smartphone, and we're seeing now with healthcare that this is another opportunity using technology to be able to improve access to care. Video consults, telephone consults are another way to be able to access healthcare, and there needs to be proper safeguards in place, and that's what we're working through at TEND. If you still need to have a face-to-face consult for a physical exam, or where you are unwell, we'll be able to see you online, but then quickly refer you to one of our clinics as well.
For a doctor, the benefit of having someone sitting within a couple of metres of you and being able to, I guess, pick up on their body language and their tone and things like that, is it always going to be preferable to have someone in an office with you?
You can do some of that over the phone and over a video consult. The vast majority of clinical reasoning or decision making is based on the history. That is the type of patients the type of symptoms that you describe. If you say you've got a cough, fever and shortness of breath, we might well consider COVID-19 in the current circumstances. So it's that kind of information that you share that's one of the key things for making a diagnosis, and that can be done virtually or over the phone as well.
That's brilliant. Thank you for joining us this morning. This is fascinating, the way that our future will change in so many ways after we hopefully get on top of COVID-19. Dr. Mataroria Linden,